All right, so our group, Hospitals and Health Services, we had a really, really active group. And I know the number of people sitting there were actually really struggling to get a word in. So that was a really good sign, I think, for our particular system. We focus particularly on the ABCD approach, so how we can go about actually making sure we routinely ask everybody about their smoking and ways that can be done in terms of where it gets documented, who's going to do that, whether we assess levels of dependency. Around brief interventions, we talked about what is the offer of support and the differences that exist between inpatient environments and non-inpatient environments, so those community services that don't necessarily have access to NRT. Will there ever become a time when they can? What are some of the things we might be able to do to speed that up? And then the interfaces between hospitals and primary care services as well in terms of who needs to talk to each other. Certainly within this area, we are talking, keen to see hospitals and the community services talk much more than is currently happening. So there were, a couple of actions that really stood out among that group. And there was some talk about electronic medical record being set up for the region, so shared by a number of services. And that was an opportunity, I think, for us to think about where smoking might fit into that. And we went even bigger again, saying not just smoking, what about overweight? What about some of these other risk factors that sooner or later we're going to be having these same conversations about needing to record systematically. So we'll do some work to try to find out those systems, who's governing them and where the opportunity is to actually input into them.
We asked a little bit about resources, so what would actually help the health services out there, and it came back to really support around clinical guidelines and the consistency of the message. So not just for people working in that, but for also medical staff that may, do rotations through various health services as soon as we have a different process or a different clinical guideline. So that was something that came through recurrently, was having standardised clinical guidelines, evidence-based clinical guidelines, and access to supports to quit. So things like medication, as well as what other tools and supports are out there, or the quit resources and so forth as well to support both community and hospitals in achieving smoke-free. So I think that was about, I'm just looking back at our notes.